Hi, this is Dr. Michael Horwitz bringing you another episode of Podiatry Help Desk brought to you by Feet for Life Centers and CleanSpa. So, what we're going to do today is we're going to discuss lasers, how, when, and why they should be used to treat fungal nails. So lasers have been around for a while now. They found out a long time ago that lasers can actually suffocate fungus, and that's the mechanism of action. What you feel when you get laser treatment is usually a little warmth, but it's not actually curing the fungus by warming the nail. However, you'll feel warmth. The fungus is actually being cured because of the radiation and the fact that the organisms are actually suffocated by the particular process. Now, lasers have gotten to the point where they become profitable. In other words, using them makes doctors money. So you should know that every market commands a certain price for utilizing lasers. We do know they work. We also know that they don't work very well when used as just plain old laser technology without anything else. In the previous video, we talked a little bit about debridement. We talked a lot about it actually because I feel that without debridement, you're not going to effect a mycologic cure very easily using any other approach. Debridement is the most important. Lasers come in different wavelengths and actually there's different mechanisms of action that are utilized when using laser. And what I do know that works is that lasers that use a constant low-level radiation and a burst mode are both very effective and can be worked either separately or in combination to cure nail fungus. So the first video we show you shows this green light. That's the laser guide light. It's not actually the laser, but it's the light that helps us aim the laser. And we're using something called burst mode. Now, many doctors use more of a continuous type of laser when they treat fungus, but I found that using a combination of lasers actually works very well. We're using burst mode here, which actually uses bursts of energy to go to areas where fungus accumulates on the nail plate. And if you look closely, it's hard to tell on this video, but you'll see that each time there's a burst of energy, you'll see some plume or some energy going right to certain areas of the nail, and that's why I like burst mode and why it's helped us cure many fungal nail infections. In this next video, we're showing you constant energy lasers. This guiding light is a red light. It's not the laser light, but it helps us point the laser where it needs to go. And you'll notice that we're using this in a sweeping fashion. That's because this laser energy can heat up the nail enough to where we need to keep moving the laser or the nail will get too hot. These are class 4 lasers. They need to be used correctly in order to work, and they need to be used more than once. Anybody offering lasers that are guaranteed single use, no debridement, money back guarantees, I would strongly suggest that you just run from those treatments because all they're doing is the same thing that you're buying into when you buy insurance for an electronic product. They're hoping that you're not going to come get your money back in a year, and they're offering some weird satisfaction guarantee. And of course, what I'm going to tell you is that it should take less than a year to cure fungal nails if it's done and expedited with proper grinding, much less than a year. A, and B, get your money back if your doctor's offering you a money back guarantee and it's not working. So what is value-based laser? Well, in my opinion, value-based approaches should involve treatments that are $250 a piece in markets as small as St. Louis and maybe $300 or $400 a piece in markets as large as New York. If you're paying $800 for single treatments, you're paying way too much money, in my opinion, for laser. I'll probably get a lot of hate mail from doctors for saying that, but I can tell you that it's not difficult to use lasers. The technology has come down in price. What used to be a $50,000 piece of equipment is now $16,000, and this value can be passed on to patients and should be. The thing that we do at CleanSpa is once we take you to the point where we both can comprehend that you want to go for a cure, is that we offer a package that allows you to get a few laser treatments at under $500, meaning 2 laser treatments at $250 a piece, and then all of your additional treatments, should you need them, are only $50 a piece. This is what I call value-based approach, a value-based approach to laser treatment. Patients that come in essentially become a part of a club. they know that after their first 2 treatments, they can come in and a year, 2 years, 3 years down the line, come into the spa and get $50 laser treatments as maintenance, or simply laser treatments as they need them or think that they need them from CleanSpa. Now that's real value. Consider that if you had, say, 10 laser treatments, the cost per laser would go way down. And I don't think enough doctors utilize this approach. The point is you should seek value when it comes to lasers and not buy into the idea that the laser is what's curing your fungus, because as I said before, and I'll continue to repeat it, without additional treatment, or what I call the kitchen sink approach, you're not likely to have a lasting cure. So what about oral medication? So what you need to know, in my opinion, about oral medication is, does it work? Yes, orals do work. Will they cure your nail fungus without any other treatment? Well, they can create the scenario where your nails can get cured. Are they dangerous? They can be dangerous. If you have the inappropriate liver enzymes, or your kidneys are not functioning properly, there can be damage to your body from this. Also, if you're into natural cures, you're not going to want to use these oral medications, and it's pretty common now for people to come in and say, I don't want this oral medication, so we respect that. Do you need it to cure your fungus? Absolutely not. What we do, however, is we like to use a little bit of fluconazole or diflucan, 1 pill a week, which is nothing. It's a very small amount of medicine designed to control yeast. So this is just a pearl taken right out of my office. If you're a doctor, please feel free to steal it from me. It's not uncommon knowledge entirely. It's simply the lowest dose that a patient could have to effectively control the amount of yeast in your body, which I feel is important. In other words, control of yeast is important in order to control dermatophytes. So yeast and dermatophytes are different. Yeast presents as more of a whitish appearance of the nails, and of course can occur in the body in all sorts of manners, which usually promotes itching in particular areas of the body and other problems. So keeping yeast down in these cases is important, and utilizing an oral to do that is something that we do consider. That said, you may ask, can you cure your nail fungus without any oral medication and with just topical and grinding? And the answer, as I said before, is yes, you can. But laser is greatly helpful, and a proper kitchen sink approach is really what I believe you should be looking at with your professional, your doctor, when considering curing your nail fungus. So in this video, I think we cover just about everything that we need to cover. The efficiencies of treating this. I'd like to leave you with this important point. Don't do this at home if you are unhealthy and if you can't control the debridement process. That's why you see a professional, because the debridement process can be tricky. And I hope I've stressed enough how important that is. In the next video, we're going to discuss stuff that you cannot find on the internet. I challenge you to look and find what I refer to as the alternative methods or alternative treatments when it comes to treatment of chronic severe fungal nails. Until then, this is Dr. Michael Horwitz with the Podiatry Help Desk, bringing you another episode of controlling your fungus with value-based approaches. If you like this video, please give us a thumbs up. And if you subscribe to my channel, I promise you'll get more great information about our podiatry services that will help you better understand the subject of podiatry and how you can be helped. Thank you.